Okay, good morning. So, we have started with the disorders of urinary system already. You might have seen the conditions coming under urology system. Okay, so today you are moving on to a new condition under urinary system, that is nephritis. Okay, now what do you mean by nephritis? When we split the word into two, there is nephro and itis. Nephro means in this it is something related to your kidneys, whereas uh, your itis means inflammation. So what happens here is there will be inflammation of the kidneys. Okay, so let us see the definition. Nephritis is a condition in which nephrons inflamed. Nephrons means nephrons are the structural and functional unit of kidney, as we all know. Here, nephritis is a condition in which nephrons of the kidney are inflamed. Okay, and it is also known as glomerulonephritis. Now, we are moving on to the types of nephritis. There are many types of nephritis, like we have acute glomerulonephritis, then chronic glomerulonephritis, lupus nephritis, then hereditary nephritis and all. Okay, so let us see about each one in detail. Acute glomerulonephritis, as we all know, acute means sudden in onset. So these types of nephritis can develop suddenly after a severe infection, like after a streptococcal infection or HIV or hepatitis. There will be sudden infection of the nephrons, that is known as acute glomerulonephritis. Next is lupus nephritis. You might have heard about lupus condition called lupus. It is an autoimmune disorder. Here there will be due to this condition called lupus or autoimmune disorder called lupus, there can be acute inflammation of the kidneys. Then the third one is hereditary nephritis or Alport syndrome. Okay, this disease can cause kidney failure, and even vision or hearing problems can also occur due to hereditary nephritis or Alport syndrome. So here it is passed on in the genes, that is it is hereditary, occurring hereditarily, so it is known as hereditary nephritis. Then the next one is chronic glomerulonephritis. It is a form of nephritis that develops slowly, and in early stages it causes only few symptoms. Okay, next is IgA nephropathy. Next type is IgA nephropathy. This is one of the most common forms of nephritis. When IgA antibodies are formed inside the body and it is deposited in the kidneys, it may cause inflammation of the kidney or nephrons. It is known as IgA nephropathy. Okay, next is interstitial nephritis. Here the inflammation will be at the interstitium, that is the fluid filled space which is present in the nephrons. So here the nephritis will be affecting the interstitium of the kidney. Okay, this usually occurs due to any infection or a particular medication. These are the types of nephritis. We have seen acute glomerulonephritis, lupus nephritis, hereditary nephritis, chronic glomerulonephritis, IgA nephropathy, and interstitial nephritis. We are moving on to the etiology of nephritis. As we have seen, there is a genetic component in this. We have seen some of the forms are transferred through the genes. So, there is genetical component as an etiology. Then certain infections like we have seen streptococcal infection, streptococcal throat infections and HIV, hepatitis B and C. All these infections can lead to nephritis. Then medications like antibiotics, NSAIDs and diuretics can lead to nephritis. Next is risk factors. When we have a family history of kidney disease, the patient is at a risk of, we are at a risk of getting nephritis. Then those who are having hypertension, diabetes, and those who are obese. Then heart diseases, and at the age of 60 years or more. That is, elderly people are at more risk of getting this. Now, next we are moving on to the clinical features of nephritis. There will be change in urinary habits and edema in the body, especially over the hands, feet and face and ankles. Then there will be change in the urine color, and urine will be foamy or frothy, and there will be hematuria also. These are the clinical features. We are moving on to the diagnostic evaluation. We may go for history collection, physical examination and all. Then the doctor may advise you to conduct a routine blood or urine test. Then the best way to check nephritis is biopsy. We are moving on to the management. Management may vary according to the cause and type of acute nephritis. If the patient is having acute nephritis, it may resolve without treatment. And if it requires medication, the doctor may prescribe certain medications and may prescribe certain procedures to remove excess water from the kidneys. Not only excess water, some dangerous proteins are also being removed through the certain procedures. Then if the patient is having chronic nephritis, the patient may have to go for regular kidney checkups and BP monitoring. Then if the patient is having hypertension, the doctor may advise antihypertensives and diuretic medications. Then if the patient is having autoimmune disorders, the medications may be advised to prevent the immune system from attacking the kidneys. Okay, then the doctor may advise the patient to consult a dietitian, and she or he may prescribe a diet which is lower in protein, salt and potassium. Next, we are moving on to the preventive measures. Here, the patient has to maintain a healthy weight. Then, if he is a smoker, that is to be quitted. Then, blood pressure control and blood sugar control. Then, regular exercises. Then, nutritious, balanced diet to be taken by the patient. Now, we are moving on to the most important part, that is nursing management. Here, physical examination. In the assessment part, we have to complete physical examination to be carried out. Then weight monitoring. Daily weight monitoring should be performed. Then intake output chart to be made. Every 4 hours, the nurse has to check that. The intake output chart. Then vital signs, especially BP and pulse rate to be checked. Then breath sounds to be assessed, and we have to see for any adventitious breath sounds. Now we are moving on to the nursing diagnosis. Based on the assessment findings, we can formulate the nursing diagnosis like ineffective breathing pattern related to inflammatory process, impaired urinary elimination related to decreased bladder capacity or irritation secondary to infection. Then excess fluid volume related to decrease in regulatory mechanisms with the potential of water. Risk for infection related to decrease in immunological defense. Then imbalanced nutrition less than body requirement related to anorexia, nausea, vomiting. Risk for impaired skin integrity related to edema and pruritus. Hypothermia related to ineffectiveness of thermoregulation secondary to infection. The specific nursing interventions include activity. That means blood rest should be maintained until the acute symptoms and hematuria disappear. And infection prevention, like the patient should avoid contact with people with certain infections. Then monitor intake output chart. As I've told you, every 4 hours that is to be checked. Then keep the intake of the patient within prescribed limit. Then monitor BP. Then urine characteristics, like for any protein and hematuria. If it is there, that is to be checked whether it is present or not. These are the specific nursing interventions to be performed if the patient is having nephritis. So we have seen today regarding the definition of nephritis, that is the inflammation of the nephrons, and the types like acute glomerulonephritis, which occurs suddenly. Lupus means due to the autoimmune disorder lupus. Then hereditary nephritis or Alport syndrome, hereditary which is transferred through the genes. Then we have chronic glomerulonephritis, which develops slowly. Then IgA nephropathy, due to the deposition of IgA antibodies in the kidney, there can be inflammation, that is IgA nephropathy. And interstitial nephritis, which causes inflammation of the interstitium. Then etiology, like we have genetic components and certain infections like HIV, hepatitis B, all those things. Then medications like antibiotics, NSAIDs, and diuretic medications. Then we have risk factors like family history, high blood pressure, diabetes, obesity, heart disease, then elderly. Then clinical features like change in urine habits, edema, urine color may be changed for foamy urine, and hematuria. Then diagnostic evaluation, we may go for all the other tests, then blood culture, urine culture, and biopsy is the best way. Management, mainly acute glomerulonephritis may resolve by its own. Then chronic patients may have to undergo regular checkups, and BP should be regularly monitored. If the patient is having hypertension, BP medications to be given. Then if the patient is having autoimmune disorders, medications to prevent the immune system from attacking our own body, that is to be given. Then diet, which is low in protein, salt, and potassium. Then we have seen the preventive measures. Healthy weight, smoking, quitting, then blood pressure and blood sugar regulation, exercise, then balanced nutritious diet. We have seen the nursing management also, the nursing diagnosis, interventions also. Okay, hope you have understood. Thank you.